Hello everybody. Welcome back to Medical Monday. This is another topic that's near and dear to our hearts because it's something that we treat on a daily basis.
Yes.
A lot of patients have this, and we want to talk about sciatic pain.
Yes.
There's about a $240 billion cost to healthcare and lost wages from the recent article in the Journal of Osteopathic Medicine. That's a lot of money,
Yes.
but really we also want to add in that part of that treatment is lost wages, because oftentimes when patients get this, they are down and out and not able to work for an extended amount of time, and also dependent upon the treatments.
Yes.
There's surgery that can also take you out for even longer time.
Yes, absolutely. 100% correct there. Sciatica is no joke if you've ever experienced it. If you know somebody who's experienced it, then you know the state that they're in, the inabilities that they have, and really that it's important to get back to that function because it's difficult to function when you have that kind of pain.
It's difficult to function. Patients can't stand up. The ones that are working can't do the movements. Patients that are sitting at a desk, the same thing. That pressure can also cause excruciating pain. So it's really, you can't stand, you can't sit. There's really a whole lot that's very, very limiting for patients that have sciatic pain.
Yep. And speaking of limiting, our audience is only so big, so it's important to be able to share this with as many people as you know. So be sure to like, share, subscribe, because the more we actually get the word out, the more we can educate the public and really support everyone out there, because that's what we want to do. That's what Medical Monday is for, is to actually educate the public so that you do what's best for you and know what resources are out there.
Exactly.
Yeah.
But when we talk about sciatic pain, what actually is it?
Yes. What is the sciatica? Well, believe it or not, the sciatic nerve is a nerve. It's actually named after the nerve. Like, we're going to say this word a lot. Sciatica is the name of the condition.
Or some people say sciatica.
Sciatica. I got that sciatica going on. We can help that. But yes, so it's actually named after the nerve. It's the largest nerve in the human body. It comes from the low back, as you can see here. And what happens is what's called nerve roots, which is just a part or a branch of a nerve, comes out, and then they come together to create a large nerve that then travels down into our legs. It has a specific pattern that it follows. You'll see that here in a moment. But one of the big factors is the muscles in our buttock area, our derriere, are actually a factor here. And you can see three different images here where the nerve is under the muscle, goes through the muscle, and that nerve is actually split, or the nerve itself goes through the muscle 100%. And it's really about a third in regards to the population and which one you are.
None of these patients are wrong and none of them are right.
Correct.
It's just the normal abnormality of how that nerve is going to come out of the spine. And then as it travels down your leg, it's got to get through the buttocks area, large muscle, either go underneath it, kind of split through it, or all the way through it.
Yep.
They're all the same. There's no right or wrong for these patients. It's just kind of normal.
Yep, they're all normal. But what happens is that muscle that you just saw a picture of will put pressure on things, or different aspects of pressure on those nerve roots, and we get different patterns that exist that describe or create that sciatic pattern or those sciatic symptoms. It is a specific set of symptoms and covers a specific area down into the low back, buttock area, and into the thighs. But everybody's a little bit different in how they present and how they're affected. What makes it not so much easy to diagnose, but what makes it easy to treat, know what's causing it, is because of these patterns that have been studied and seen
To where
throughout.
we get to see the location. This leg here is a very good representation. Whether it's pain down the back of the leg, the side of the leg, or more the front of the leg, these are nerve roots. Now these roots come out of different areas or different levels from the spine. So depending on where your pain is at, we know which area that it's having impingement, where it's having tension, where it comes out of the spine. It really helps pinpoint the actual treatment of it.
Yep. And so just like he's talking about, this is a picture, just a model of the spine here, and you can see the disc here on top. And then there's a bone, and then there's a disc, and then there's a bone. Well, you see these little yellow things poking out, and what these are the nerve roots, and that's what comes together to form that sciatic nerve. And there can be different pressures in different areas.
So, like that, there are different levels. So say this nerve is impacted. It could be the back of your leg, where this nerve would be the front of your leg.
Yep.
So because of where it's located of the pain, we know which level of the spine there's actual nerve root damage.
It's really neat. It's very cool. The human body is a mysterious thing and yet very intriguing and wonderful thing to work with. So a little bit more about the anatomy, and like what we were just talking about, the low back stacks, as you can see here, and the vertebra or the bones are very similar in how they stack, and those holes that you see through here are actually where those nerve roots come out of. And so what happens is we can have different types of degenerative change. We can have muscular changes because muscles move joints, and that does not move as well as that. It just doesn't work out that
But
way.
the good thing with treatment options for this, muscles, we know we can rebuild those through rehab and some other things, but really that degeneration that she just had on that slide previously from the North American Spine Society noted there's a very high likelihood of good treatment success with these patients. So just because you have degeneration or arthritis within that joint space doesn't mean that it's an end-all be-all. It is very, very treatable.
You said the A word. I call it the A word, arthritis. So many people think that is almost like a death sentence. Oh, I have arthritis. I can't. Well, we just got to move it. If we can move that joint, if we can get some vitality back in that joint, it's 100% likely to get better function and better movement and better strength to no longer have arthritis. Work through it. So yes, absolutely, 100% correct. So what are some things we can do at home or even just on our own time through our own knowledge and research and things like that? You hear us talk about rice all the time. Well, we're going to talk about rising.
This is a different aspect. Rice is more for muscles, where here we're dealing more with joints. And joints do need to move. They are encapsulated with a fluid that needs to pump so that the metabolism in there makes that fluid very, very liquid and provides that lubrication so that joint, which your back is a joint, it needs to move.
Yes, it does. And so what we want to do is we want to rest, just like this puppy on a hammock. So we need to rest sometimes. We go, do, and push through. Well, you got to let your body rest and recover. So that's very important, especially when we talk about things like sciatica. You got to ice it. This woman's going down an ice slide. There's no better way to ice your butt than on a slide made of ice. So if you find one, definitely use it.
Moody Gardens.
Moody
Gardens during Christmas time.
I
They
didn't
have
think
the
about
big ice, and there's a big sleigh slide that you can go down.
Well, I need to find it. So.
It's very good that they give you a plastic to slide down. Otherwise, you'd have a wet butt.
That's
in the
very
end.
true. But I like to use extreme examples because it's easy to know. Just ice where it hurts. But ice helps because it helps reduce the inflammation to really allow that recover. We want to stretch it. Behind Lonnie's head here, there's a woman doing a very awesome stretch for the low back, glute, as well as into that thigh. And so there's different movements you can do. YouTube is a phenomenal resource to be able to find stretching positions. And then we're about to hit a slide that talks about yoga. It's one of the best things for sciatica, especially at home.
If you're going to Google specific stretches, this lady is doing the piriformis stretch. And that is that muscle that Dr. Gabby had on a slide earlier where it travels through. So that's the muscle that you want to stretch and strengthen if you're ever having some sciatic issues to try at home.
And then exercise. This lady right here is doing prancercising. I don't know if you've ever watched prancercising.
I've heard jazzercise, but not prancercise.
This woman is prancercising. She's the CEO, founder of Prancercise. So no matter what, find something that you can do. This lady invented Prancercise. It's awesome. She's got ankle weights on. I'm not telling you to use ankle weights, but I'm telling you to find something to move around, strengthen, pump those muscles, move those joints. Sometimes you got to work through the creakiness of it just because it's uncomfortable to move and it hurts, but the greatest thing is once you start doing it, you get that momentum, you make that progress, you get that strength back, and then all of a sudden you're back in the bowling alley. All of a sudden you're keeping up with those grandkids, and that's what it's about. It's getting that function in life back.
Yep, definitely.
Yeah.
The more indicator of these patients having chronic issues are ones that don't do movements, ones that just lay there and just, I'm in pain. You've got to get motion, you've got to get movement through there, whichever way you find that the most comfortable for you, but slow and steady with those.
Very, very true. And then the yoga poses I talked about. Tons of yoga positions you can do in a seated position. You can do it on the floor, on your bed. Like just what's great about yoga is there's a lot of different ways you can perform it and really incorporate it into your day-to-day. Typically with a history of sciatica, you're going to have additional episodes in the future, hopefully not frequent, but just know what helps. That's what you need to do.
Definitely.
And then
know what not to do.
And what to do.
Yep.
Exactly. That's exactly what it is. You got to know what triggers it. So if you know when you wash your car once a month that sitting on the bucket causes you to have a sciatica issue, don't sit on that bucket and maybe have somebody else wash your car. It's,
Squat.
we got to
find different movements.
Yes, exactly. So it's just a matter of finding out how to modify it, other ways to get it done, and then even while you're going through the strengthening process, finding other ways to get the job done while you get yourself recovered. So
in my house, I actually have quite a few trees, and I enjoy trimming my trees in the spring. I like to clean them up, and same thing in the fall to get them ready for winter time. But with that cleanup process, it's up and down a ladder. It's very, very high, the canopy. I've pushed it up in my trees, and of course there's big limbs, and I know that doing those motions, those awkward movements on a ladder are not good for me, so I just wear a back brace. Sometimes it's not about not doing things, it's about how can you continually do the things that you want to do, but how can you modify it?
Yes.
And I just modify with a simple back brace. You can get one from Academy for like $7 to $10.
Yep.
It just provides a little bit more support as you're doing the activities that you want to do. Because remember, you still have to have movement within that joint space, and it's not about, just sitting on the couch just in case. You got to get out there and get some movement.
Got to get back to it. It's statistically wise. If you stop doing an activity because of an injury, especially when we talk about sciatica, it's very likely you're not going to go back to it. So it's super important to find those resources and tools to help support you through that process. So especially when you talk about the back braces, that's very, very true and very important to get you where you need to be so you can keep doing. That's what it's about.
Definitely. But if you've tried a lot of things at home, of course, well, what's your next option? Let's ask a professional.
Yeah.
Like, what do they think?
Yeah.
What can they help me with? What additional resources are out there that I didn't know about?
Mm-hmm. Yeah, and one of those is actually professionally guided or professionally prescribed physical therapy. A lot of times there's a significant amount of imbalance depending on what's caused the sciatica, and so it's very important to have clinically monitored and supervised and prescribed exercises, because then we can hone in on exactly what needs to be worked.
You tried the Google exercises.
Oh, we gave it a
And
Google.
if you're just not doing them right, you're not going to get the relief. The good thing is there's professionals out there, physical therapists, that can help monitor, rehab, and help you to where you feel the stretch in the right place, and that you hold it for the appropriate amount of time, and that you're progressing.
Yes.
That there's good check-ins for this so that you can get the best results.
Yeah, exactly. That progress is so important, because if you're not making that progress, either not being challenged properly or we're in the wrong area. So awesome.
Sometimes when you're having a lot of pain, you don't want to move. It's very understandable, but you can't fall into that vicious cycle. So oftentimes what will your primary care do? They'll prescribe some medications, something to help you feel a little bit better as you go through therapy, as you get up and get moving. The problem is we want to make sure that we're not just utilizing the medications, that we're only using those temporary while we go through therapy or while we do our movements to get back to life.
Yes. I love to compare this to your tools that you utilize, like the back brace you were talking about. These pills or prescriptions are very specific to just help you get through that phase. If you've ever worked out and the next day woken up, you're like, why did I do that? I'm so sore. Well, that's part of the process when you start working through aspects of old injuries like sciatica or things like that, because we haven't been using those muscles properly. So it's very important to have those tools and to know when you need to use them and when
really
not.
how you should use them.
Yes.
We have a large over-the-counter options for us, but most of them, when we look at back pain or back relief or sciatic issues from the shelves, they contain Motrin or ibuprofen. The problem with that is that they can cause ulcers when you're in your stomach. You should only use them for a short period of time. However, people use them chronically all the time. And unfortunately, about 85,000 people a year die from taking over-the-counter Motrin or ibuprofen because of a bleed in their gut. So it's very unfortunate. They're trying to do the best that they can. Unfortunately, it's just you're overusing the medication and underutilizing the movements and rehab that should be done.
Very true. Very true. And then also, we don't want to see this happen, but it can happen, and that's surgery. The need to actually stabilize that section of the lumbar spine that feeds into the sciatic nerve to get pressure off of it. Sometimes there's just so much degenerative change. Sometimes it's due to trauma, but really at the end of the day, these are very extreme cases that need it, but it does exist. It's there for you when you need it, and there's a recovery aspect, but it's important when it's necessary.
It's also important to realize that when you do have back surgery, while granted it's for a specific purpose, that now this spine is fused from here to here. So what about this joint right here? This one, unfortunately, still needs to move, but The other ones are frozen. So you need very specific movements and very specific things to ensure that you don't just keep increasing and increasing from one disc to the next, diffusing further and further up or down your spine.
Yep, absolutely. And sometimes that can correct the problem temporarily, and then 10, 15 years later, all of a sudden, we're starting to have symptoms from that nerve root that you were talking about. And then also, it's in our name, back pain.
Yes, it
and
is.
Joint Center of Texas.
And
so we
Center.
do love talking about what we're able to do for you here. So please make sure that you share it with friends. And so it's super important. We can actually do some regenerative injections in that low back depending on what's going on. It's called PRP, or platelet-rich plasma. And it really just depends on the amount of scar tissue and what's going on. But it's when we use your white blood cells to inject into the scar tissue and the larger muscle groups in that low back to help reduce spasms and help with the recovery and get better engagement with those muscles. It's actually what Lonnie specializes in.
Part of the platelet-rich plasma, what they're, not for the spasms, but only for increasing blood flow.
Mm-hmm.
So you want to increase blood flow to those muscles because there's damage within those muscles. There's damage, so now they don't function properly, and they have what's called scar tissue. The good thing about platelet-rich plasma, the regenerative portion of it, is that it helps chew away some of that scar tissue, the bad tissue, and helps lay down fresh, good tissue that moves, one, appropriately, and also has the strength to give you the fun of activities, the fun of life, to be able to do the things you want to get back out and play tennis, but unfortunately your low back hurts. You maybe played tennis for 20 years, and now there's a lot of scar tissue that's very, very tight in there and now limiting your movement. We want you to have movement to also help those joints.
Yeah. And I just learned something, so I'm going to share this video. And then also, here's the spasms.
Yes. So we also do trigger points for the spasms. So we have scar tissue that limits our movement, but then we also have spasms. Now, spasms are the body's natural response. If you have some sort of shift or some type of pressure on a nerve root, those muscles in your lower back will tense up. They're trying to hold the spine because they don't want it to move anymore because there's pressure on a nerve. However, we've got to relax those muscles so that the joint can move. Remember, we have to move that joint, and by doing so, or allowing us to, we have to relax those muscles. Mm-hmm. Once they relax, then they get a great adjustment, they get great rehab, and it's really added all together to get very good response very quickly, because this is very, very painful for some patients and debilitating. The disabilities oftentimes related to low back pain or sciatica, and we talked about the $240 billion that it costs. A lot of that's lost work.
Yeah. So it's very important to do a comprehensive approach to take care of all aspects to get you back to work, back to home, taking care of what you need to. And you mentioned rehab, right?
Perfect.
We do rehab to make sure that we correct where the imbalances are. If a muscle is still engaging, or if a joint is still moving and it's not doing it properly, other muscles have to engage to make that movement happen. So we've got to make sure that we make those changes and engage to reverse a lot of the effects from compensation and strength changes. So it's very, very important. We also need to get pressure off that nerve root. So we have specialized equipment called decompression chairs.
Everybody's favorite treatment, by the way. Everybody loves it.
Forget about our awesome faces and how cool we are. They want to sit on that thing.
If those things could sign autographs, I think they'd walk out and just be famous.
Yeah, they'd be like, wait, I'll just take one of those instead. But the decompression chairs, they actually help to open up those joint spaces to get pressure off of those nerve roots we were talking about. And also they have a lot of other additional therapeutic benefits in regards to vibration therapy to help increase blood flow, and just all about getting the best function possible. And then also, it is crazy important to get adjusted. We live through life doing things, going about, tripping on things, sneezing. I mean, the wrestling we do with our kids, the car accidents we survive, the football we play. Like, I can just continue on with the things we put our bodies through stress-wise. So with that, it's super important to get adjusted to align that spine for the best function and movement in those joints to support those muscles. We talked about that comprehensiveness and making sure that we strengthen and that we support the muscles for the recovery and allow them to relax more efficiently, and also make sure that we align the spine to get that nervous system functioning and those joints moving properly. Crazy important there.
Yes, but it's a good comprehensive plan. So sciatic pain unfortunately affects a lot of patients. Mm-hmm. There's great treatment options. There's things that you can do at home. Some other professionals out there. We talked about some of the specialized things that we do here. Mm-hmm. The bottom line is You need to know what sciatic pain is, what causes it, and of course, some things that you can do, and know that it's really just manageable. Okay, it's not something you have to live with. It's not something. Oh, I'm getting older. I got sciatic pain. That's not the case. It's very, very treatable through multiple different modalities. I hope y'all learned a lot.
Yes.
And if you don't have sciatic pain but know somebody who does, make sure and like and share the video so that they will get it, and hopefully they can learn some good tips and tricks to deal with it.
Yes, because nobody likes a pain in the butt, and so let's correct it.
Let's correct it. But we'll see you next Monday for another educational tip.
See you next time.
See ya.